So cancer is caused by smoking, right? Well, not exactly. Although habits like smoking can increase cancer risk, there are some types of cancer that are caused by seemingly random events. An example of this is neuroblastoma. Neuroblastoma is one of the most common childhood cancers and affects children most often under the age of 3. Unfortunately, more than half of these patients with high-risk disease will not live longer than 5 years. These kids are treated with surgery, radiation, and toxic chemotherapy drugs with significant side effects that persist even if the cancer is cured. An example of that is hearing loss. Cisplatin is a drug that is used to treat a wide variety of cancers, including neuroblastoma, and is known to cause irreversible hearing loss. These patients frequently have their doses of cisplatin reduced when they detect the hearing loss, and this drug is potentially life-saving. This drug is known to affect hearing through various mechanisms, but one of them, which is most important, is through the damage to the inner ear. So if it's so important for these patients to be able to hear, then what can we do to allow them to have cisplatin but still not affect their hearing? Well, my research uses the zebrafish. And although zebrafish don't technically have ears, we can still use them to model hearing loss. Zebrafish do have something called neuromast structures along the sides of their body, which help them sense balance, which you can see behind me as green dots. These structures are similar to the structures in our inner ears that are damaged by cisplatin, which causes the hearing loss. We can treat our fish with cisplatin and show that these neuromast structures are degraded. So we've created a fish that's functionally deaf, which you can see at the bottom of the screen. We can then use this model to help find a protective drug. But what about the cancer? Well, our lab has developed an technique where we can inject human cancer cells into young zebrafish and show that they move and grow similarly to how they would in a petri dish or in a mouse. Importantly, we can show that when we treat these fish with cisplatin, there's a reduction in the growth of these cancer cells. We can visualize neuromast health and cancer cell behavior in the same fish at the same time. Therefore, I propose that we use this exciting new model to help find a drug that will protect the neuromast structures or the patient's hearing while still effectively killing the cancer cells. Thank you.